Hi, my name is Dr. Marwan Sheikh. I'm a reproductive endocrinologist. I have been in practice for over 35 years. As a matter of fact, I started the first IVF program here in North Florida and in Central Florida. Today, what I'm going to talk about is what to expect during the IVF cycle. When you say in vitro fertilization, it is very intimidating for a patient and overwhelming. The fact is that the treatment is extremely simple and easy. I will start by saying briefly exactly what the cycle entails. Basically, you would call with your period, if you have periods, and we start you on a birth control pill, which you take for a couple of weeks. You stop the pill for 5 days, start fertility injections, which you would take for about 10 days. And in about 10 days, could be 9, 10, 11 days, the follicles that are the sacs of fluid in the ovary that have eggs will be ready. We give you a trigger shot, and 2 days later take the eggs from you, which is a very simple procedure. Fertilize the eggs, and 5 days later put one embryo back in you. That's in a nutshell. Now, in a slight detail, the first thing we do is we try to do some blood work on both the male and the female, which are required by the Food and Drug Administration, and basically to check for any genetic traits that are abnormal, and to check for sexually transmitted diseases and for anemia and things like that. So this is just a blood test that both the male and the female will have to undergo. The second thing in preparation for IVF would be to check the uterus. So here's the uterus, and the uterus can have polyps, can have tumors, fibroid tumors, can have something called adenomyosis, and the tubes can be swollen and infected. So we need to check that with a procedure called hysterosalpingogram. It's an X-ray of the uterus and the tubes. This is very important because obviously if there's a problem, we need to take care of that before we do IVF. If the tube is swollen and filled with fluid, we have to take care of that before the IVF process. So that would then comes the first step, which, as I said, you call with your period. We start you on the birth control pill. Now the question, okay, well, I'm trying to get pregnant. Why the birth control pill? Basically, when you look at the ovary, at your ovary, you'll find that there are follicles, sacs of fluid that have eggs in them that are different sizes. So if we start stimulating you and then we collect the eggs, we're gonna collect eggs at different stages of development. Not good. We need all the eggs to be at around the same stage of maturity. So we suppress your ovaries with the birth control pill to stage 0, then we start stimulating them. So you would take the pill for a couple of weeks, stop for 5 days, and start the fertility injection, basically with the hormone, follicle stimulating hormone, egg stimulating hormone. And we give that for about 10 days, and the nurse will explain to you how to do that. You will be given a calendar that tells you exactly how much to take every day with the instructions. Now, the medication will be ordered for you through a wholesale pharmacy, and most of these medications you cannot get locally, so you have to order them through a special pharmacy. And we will do that for you. Of course, if we need to, we can use a discount medication program that can give it to you at slightly discounted price. Then the next step would be, after you start the medication, is to monitor you to see how the eggs are growing. And this is really simple. We used to do 3, 4 ultrasounds during the cycle. We dropped that now to 2 to make it easier on the patient. We do blood tests to make sure that the follicles, the sac of fluid that has the egg, is producing enough estrogen. And when it is ready, as determined, the eggs are ready as determined by ultrasound and the blood test, you will be given an injection, which is called a trigger shot, which prepares the eggs to be removed. You would come in early in the morning and under IV sedation, a procedure which is extremely simple, non-painful, takes about 10 minutes. We take the eggs out, and of course we get the sperm from your partner, fertilize the eggs in the lab, and either 3 days or 5 days later put one fertilized egg in you. And then we wait 12 days and do a pregnancy test. The chance of pregnancy depends mostly on your age. The transfer, at the time of the transfer, you don't need any sedation. It's extremely easy to do. It's very quick and it doesn't cause any pain. So there is nothing to worry about the transfer. The transfer is done with the guidance of ultrasound. I am one of the very few doctors that use a vaginal ultrasound to guide the transfer. I feel it's better because you can see exactly where the catheter is and exactly where you are putting the embryo in. At that time, we will discuss with you two things. One is something called assisted hatching, and the other thing, whether to use an embryo glue or not. And that would be for another presentation. We can answer those questions as needed. Thank you for your attention.